Autism is not only a great concern to many parents, the children with autism also suffer badly. It is indeed sad and unfortunate. In this video course, we focus on overall understanding of autism, which will lead to solution action by the parents and caregiver. When many young parents were told by specialists that their child is autistic, sadness and anxiety develop, and they frantically invest in solutions offered by the specialists. Unfortunately, they do not focus on overall understanding of what autism is all about, except advice from the specialists. There is a great difficulty to have the overall understanding of autism because the parents depend on specialist diagnosis. Being specialist implies they only approach from a certain perspective, which they are expert in, but not overall, not holistic. Different specialists offer different opinions. This may result in poor choice of action, and many years could be wasted without significant improvement to the child's condition, besides large amount of financial commitment and get stressed out. We will have some discussion on the historical development on the understanding of autism that show the limitation of specialist approaches. Over time, different specialists inject their expert opinion and in what way create what direction on autism solution for decades. This set of data and statistics on autism is based on report by CDC, the Center for Disease Control and Prevention in America. The trend shows 1 in 166 children with diagnosis of autism spectrum disorder by age 8 in year 2004 to 1 in 59 in year 2008. A nearly 3 times increase over 4 years with more and more children with autism. We can also see that the same trend is happening in other countries around the world. It is indeed very worrying to see this trend. What is the implication of such trend and statistic? To have the latest average of 1 in 59 children with diagnosis of autism spectrum disorder by age 8, and with the trend continuing, is surely very worrying for young parents. Will my newborn baby have autism problem? As the term autism is coined by the Western scientists, we will start our discussion on autism development from the Western scientist community's point of view first. We will not elaborate too much on the academic, theoretical, and developmental aspect, but to bring forth some relevant information to understand overall approach by the Western medical scientists in understanding autism and its treatment. Then we will present different approach by the ancient wisdom, Yellow Emperors in a classic. The name autism was coined in 1911, that is 109 years ago, by the Swiss psychiatrist Eugene Bleuler to describe a symptom of the most severe cases of schizophrenia. Schizophrenia is also the concept introduced by Eugene Bleuler. Autism and schizophrenia were all related to mental sickness as understood at that time. Eugene Bleuler was a psychiatrist and he dealt with serious mental patients like schizophrenia. And the association between schizophrenia and autism naturally became very strong. This gives rise to the perception that autism was a mental problem. Now you see that Eugene Bleuler, being an expert or specialist in schizophrenia, also made conclusion that autism is schizophrenia. Hence, a specialist set his or her own direction based on his or her expertise. Another specialist will set different direction. Now we see that as concerned parents, we need to have greater holistic understanding of autism. We will see that such association with mental sickness has a lot of impact to the subsequent scientific understanding and discovery on autism. Later in our video course, we will discuss how this becomes a limiting belief, not helping much to expand the understanding about autism beyond mental issues. The focus on mental is also from psychiatric and psychological angle. Psychological and psychiatric perspectives are again specialized perspectives, not holistic. Later, we discuss in detail how the ancient wisdom offered a holistic approach. Since the concept of autism was introduced 109 years ago, there is no lack of continuous research and study by the scientist community to find the root causes and treatment on autism. But why after 109 years of scientific intervention, we still see the trend of increasing autism rate, with 1 in every 59 children having autism symptoms as the latest figure. Today, medical specialists also concluded there is no cure to autism. Medical specialists also could not offer any compelling theory on the causes to autism. That is what we are going to discuss in detail in this video course. What could be the missing pieces not addressed? What can we as parents and caregivers do to help the autistic child? Do you notice a similar pattern? For example, the first medical description about Parkinson's disease was written in 1817 by James Parkinson. That is 203 years ago. Today, medical specialists also conclude there is no cure for Parkinson's disease, and causes of Parkinson's disease are unclear. You begin to see that the 200 years of Western medicine still have many diseases or behavioral problems like autism with no cure and little clue regarding the causes. In this video course, we will focus on the possible missing link in the underlying medical theories. We will have a small discussion on the definition of autism. Definition implies the focused understanding on the subject matter. If the definition is vague or not pointing to the right direction, then effective solution is difficult to be found. We are going to trace the development of understanding of autism by the Western scientist community. In the early years, that is 100 years ago, autism was originally described as a form of childhood schizophrenia or madness disease. As such, the poor children were often being caged and treated like animals. The name autism was coined by the Swiss psychiatrist Eugene Bleuler in 1911. The root word of autism came from Greek. Autos means self, and ism meaning morbid self-admiration, implying someone lived in his or her own world with mental sickness appearance and behavior, that is, not appear normal. So we see that the name autism merely describes outward appearance and behaviors, but gives no other clue what is happening. The outward appearance and behavior at that time were associated with madness behavior. If we take the example of someone being deprived of food for a long time, some of these people have no communication ability, their behavior may become uncontrolled and behave in a strange manner, like a mad person. Surely you will not conclude he or she is mad, but you will satisfy his or her physiological needs first, that is, to feed him or her first. Then teach him or her how to communicate and respond in a more appropriate manner when hungry. We give another example. A person is deprived from having sexual activity and the person concerned physiologically needs sexual release. Then this person may behave like a mad person. If he is not able to communicate nicely, people may conclude he is mentally mad. But if his sexual needs is satisfied, he behaves normal again. This means that For an abnormal behavior, we need to explore deeper what are the underlying causes and not make too fast a conclusion or give a label. In both cases, the appearance may seem like psychological, that is, madness appearance, but the root cause is physiological, in this case, food and sex. There are many examples whereby the root cause of the problem to strange behavior arising from physiological condition. So, what about autistic child behavior? That is what we are going to discuss in more detail in this video course. We will follow this principle to understand autism, that is, to explore the underlying causes. In our later part of this video course, as we describe the autism treatment developmental stages, we will be critical about the perspective from the many different specialists, in what way they present their view from too narrow perspective and not holistic enough. In our analysis and discussion, we use the ancient wisdom, Yellow Emperor's Inner Classic, as a guide that provides a holistic and integrated picture. We will continue to trace the development and understanding of autism by the Western scientist community since 1911. Another important and significant scientist is Austrian-American psychiatrist, physician Leo Kanner, 40 years after Eugene Bleuler. Meaning, in these last 40 years, the focus was still very much on mental disorder like mental sickness or madness to explain about autism phenomena. Notice another qualification of Leo Kanner. Besides being a psychiatrist, he was also a physician. Hence, we expect him to introduce another dimension, that is, physiology, and not just mental in the understanding of autism. Unfortunately, he did not. We will discuss on this in more detail later in the video course. One of the most significant contributions by Leo Kanner on autism was that he separated autism from psychotic or mental disorder. That autism was not a precursor to schizophrenia. Leo Kanner established the fact that autism symptoms appear in child of early age, with noticeable deviation of behavior compared with the normal developed child, whereas schizophrenia occurs at the later part of life of the person. Hence, autism is present at birth and became more noticeable as months passed by. After 40 years since 1911, the attention was shifted away from mental disorder or mental madness. This is made possible by another specialist. Leo Kanner also established two diagnostic criteria for autism, that is, aloofness and a significant resistance to changes in routine, noticeable in a child by 25 months of age. These two criteria sure existed in the last 40 years, but not picked out to be included in autism. With these two criteria included, doctors and parents would pay more attention to such deviation and not necessarily on severe case of mental sickness or madness. Leo Kanner came up with the co-parenting theories as a cause to autism. It was an unfortunate conclusion. He said, in the whole group of children study cases, there are very few really warm-hearted fathers and mothers. Most of the patients were exposed from the beginning to parental coldness, obsessiveness, and the mechanical type of attention to material needs only. They were kept neatly in refrigerator which did not defrost. Co-parenting theories means parents not caring as causes to autism. This theory also caused a lot of guilt feelings to the parents. Co-parenting theories is also called refrigerator mother's theory. But in the later years, Leo Kanner did not insist so much on this theory. Meanwhile, scientists have begun to accumulate the evidence they need to overturn the misconception that autism is merely psychological in nature. In 1964, Bernard Rimland published the first book focusing on biology and genetics in relation to autism, but no specific reference was made on biological cause, more in general. This is very unfortunate. We will discuss more in the video course later. Due to development of genetic science at the time, genetics became the focus as possible cause to autism. Let's make a brief summary. Since 1911, when autism name was coined, till 1964, a 53-year span, the attention was shifted away from the mental madness, from refrigerator mother theory, and somehow from psychology to biology and genetics. This also showed the expansion of specialists from psychiatrists, psychologists, to physicians and gene scientists, but this is still not holistic, as today's statistic is still 1 in 59 children case of autism, meaning many different specialist input have not helped reduce the rate of autism. There is no improvement on the autism rate. We will continue to discuss what could be the missing pieces. With more and more studies made, scientists find the need to revise the definition of autism, as there are more and more other symptoms and behavior that indicate abnormality discovered by different specialists. In 1952, first edition of DSM was published. DSM is Diagnostic and Statistical Manual of Mental Disorder. DSM contained a glossary of description of the diagnostic category. The first edition of DSM-1 contained much of Leo Kanner's influence. The second edition of DSM-2 was published in 1968. The third edition of DSM-3 was published in 1980. DSM-3 listed specific criteria required for the diagnosis. It defined 3 essential features of autism: a lack of interest in people, severe impairment in communication, and bizarre responses to the environment, all developing in the first 30 months of life. The fourth edition DSM-4, released in 1994 and revised in 2000, was the first edition to categorize autism as a spectrum. A spatial disorder is included. A spatial disorder refers to people with high IQ but little or no EQ. They have little or zero social interaction skill. Please note that since the fourth edition DSM-4, released in 1994, the idea of autism spectrum disorder was introduced, meaning more cases of autism symptoms are captured, and DSM-4 fourth edition provided the standard of diagnosis since 1994, that is, 26 years span. The rate of autism cases since 1994 till today is still on the increase. Throughout the 1990s, researchers hoped to identify genes that contribute to autism. After the Human Genome Project was completed in 2003, many studies tried to zero in on the list of autism genes. They found hundreds but could not link any exclusively to autism. It became clear that finding genetic underpinnings and corresponding treatment for the 5 conditions specified in the DSM-4 won't be possible. Experts decided it would be best to categorize autism as an all-inclusive diagnosis, ranging from mild to severe. The 5th edition DSM-5 was released in 2013. DSM-5 adopted the idea of a continuous spectrum and used the term ASD, autism spectrum disorder. Spectrum, like the spectrum of light that contains different degree and intensity of color of light, like the rainbow, implies it is difficult to pinpoint specific behavior as autism, but a range of behavior. The DSM manual gets thicker. DSM-1 has 130 pages covering 130 disorders, and DSM-5 has 947 pages covering 300 disorders, and the autism rate is still increasing. Why is that so? We will discuss further. One of the latest definitions of autism is a developmental disorder of variable severity that is characterized by difficulty in social interaction and communication and by restrictive or repetitive patterns of thoughts and behavior. This definition is no longer using the madness as indicator, but social interaction and certain restricted and repeated movement of behavior and communication problem. So far, we have briefly discussed the understanding and development of autism since 1911, that is, 109 years ago till today. For the first 53 years of the 109-year span, focus about autism was on madness and the theory of refrigerator mother as a cause of autism. Both were then abandoned, and the search for the answer in genetic science was also abandoned. As mentioned, in 1964, Bernard Rimland published his first book focusing on biology in relation to autism. But there was no continuation of his study on biology, that is, physiology. Until today, the possibility of biology as a contributing factor to autism does not lead to any interesting discovery that is widely accepted. The elaborate emphasis and more in-depth work on DSM, that is, Diagnostic and Statistical Manual of Mental Disorder, is still very much focusing on mental issue, as DSM uses the word mental disorder, no mention of biology or physiology. The development of DSM-1 to DSM-5 focuses merely on diagnostic. Since the name of autism is replaced with autism spectrum disorder, and spectrum carry the concept of near infinity, with no clear boundary between symptoms from and within mild to severe, from low intensity to high intensity, clinicians and specialists will be busy diagnosing in an ocean of signals. Parents with autistic child will be burdened financially with numerous diagnostic tests. In this video course, we will have discussion of applied behavior analysis, ABA. It is considered the gold standard intervention method used by therapists and specialists till today. In discussing ABA, we summarize the key variables used by the Western medical scientists, which are behaviors, environment, and conditioning method. And in our analysis, we show that such model is very insufficient and inadequate, hence not able to help the autistic child effectively. Then we introduce the integrated and holistic model of the ancient wisdom, Yellow Emperor's Inner Classic, with emphasis on number 1, consciousness, number 2, the body system, the physiology of the child that needs greater attention, and how to activate the consciousness of the child and balance the body system of the child. It is discussed in the other video courses of ancient wisdom that it is important to identify only the key variables and not deal with endless manifestation of symptoms which can stretch into infinity, as per the case of autism spectrum disorder. For example, in ancient wisdom, yin-yang are considered two key variables, which can manifest into countless combinations of different degree and intensity of yin and different degree and intensity of yang. It is just like 0 and 1 in the binary system in the internet digital world, whereby different arrangement of 0 and 1 give rise to infinite information. It will be fertile effort to keep digging into endless manifestation of symptoms of autism. This shows how ancient wisdom operates very differently from the Western science. It is a philosophical difference. Ancient wisdom identified the key variables and not get caught in the endless manifestation of symptom and more symptom. We will explore more in this video course about the simplicity of the ancient wisdom approach. Until today, there is no compelling Western theory on causes to autism, except mental or neuroscience. But what treatment can be done if the causes are mental or neural issue? It is just like many other diseases, example, Parkinson, diabetes, dementia, cancer, etc. The causes as per Western medicine are unknown, but plenty of diagnostics with treatments which still depend on lifelong medication for maintenance, but not cure the roots of the problems. It is obvious that when there is no compelling integrated theory to explain how autism comes about, which can result in corresponding treatment, the current autism rate of 1 in 59 will get worse. Later, in this video course, we will explore the integrated and holistic theory offered by Yellow Emperor Inner Classic that address the root causes and solution action. The following slide gives some flavor of the ancient wisdom. The earliest documented medical text in China about symptoms like autism is in the era of Sui Dynasty, year 581 to 619. That is more than 1,460 years ago, as compared with Western science documented case of autism 109 years ago. It is summarized under 5 delays, 5 softness theory. 5 delays refer to slow development in speech, standing, walking, teeth growth, hair growth. The focus is very much on comparison with normal healthy developmental stages of a child. Then, solution is on improvement on the core functionality that govern the 5 delays. Slowness in speech is certainly very directly related to common symptoms of autism. Ancient wisdom also has integrated theory on how slowness in teeth growth, hair growth are related to hearing difficulty. And some autistic children are very sensitive to mild noise. They will scream as if they hear thunder. We will discuss in detail in the later part of this video course. 5 softness refer to hand is weak or soft, feet is weak or soft, flesh is weak or soft, mouth is weak or soft, neck is weak or soft. The focus is very much on comparison with normal healthy developmental stages of a child. Then solution is on improvement on the core functionality that governs the 5 softness. For example, ancient wisdom has the interconnected theory that mouth functionality inclusive of tongue is related to heart function, and heart stores the consciousness which also include empathy and speech capability. Example of empathy is a normal healthy child can feel and understand the mother is angry and keeps quiet, whereas an autistic child does not have such empathy and continues to throw tantrum. We will discuss in detail in the later part of this video course. Are you ready to start the course now? You can find the links to these video courses at my blog www.360q.com.